When it comes to infections that we might dismiss as mild or merely inconvenient, Mycoplasma often goes under the radar. Yet, Mycoplasma infections can disrupt multiple systems in our body, often persisting longer than expected and impacting our health more significantly than we might realize. Imagine dealing with a persistent cough that lingers for weeks or unexplained pain during urination, causing discomfort and worry. These issues, while often mild, can escalate if untreated or if they spread to vulnerable people, such as children or individuals with weakened immune systems. Without the right precautions, these bacteria can easily spread from one person to another, sparking outbreaks in communal settings and putting more people at risk. Understanding what Mycoplasma is, the various types of infections it causes, and how we can manage or prevent it is essential. Let's dive into what makes Mycoplasma unique, the different kinds of infections it causes, and how best to protect yourself and your loved ones from this often overlooked bacterium. If you're finding this information valuable, don't forget to subscribe, like, and comment on Dr. Mai's channel, where we break down critical medical knowledge to keep you informed and healthy. Your support allows us to bring you essential health insights like these, so please join our community today. Mycoplasma is a type of bacteria that lacks a cell wall, setting it apart from many other bacteria. This unique feature makes it resilient against certain antibiotics, such as penicillin, that typically targets cell walls. This resistance is one reason Mycoplasma infections can sometimes be challenging to treat effectively. These bacteria are incredibly tiny and adaptable, allowing them to thrive in various environments within the human body, from the lungs to the reproductive and urinary tracts. There are multiple types of Mycoplasma, each affecting different areas and causing distinct symptoms. Unlike many infections that resolve quickly with standard antibiotics, Mycoplasma infections may require specialized treatment and may linger longer, especially if not treated early. If you or someone you know is experiencing prolonged respiratory or genital discomfort, consider reaching out to a healthcare provider for an evaluation. And remember to hit subscribe, like, and comment on Dr. Mai's channel to stay informed on how to safeguard your health. Mycoplasma pneumoniae is among the most common strains, often causing respiratory infections that may develop into what's known as walking pneumonia. Unlike typical pneumonia, walking pneumonia is often mild enough that hospitalization isn't required, but it can still be quite disruptive. Symptoms like a persistent dry cough, fatigue, fever, and sore throat may seem manageable at first, yet they can linger for weeks, leaving patients fatigued and struggling to carry on with daily life. This strain is particularly concerning in communal settings, schools, dormitories, and nursing homes, where close contact can quickly spread the bacteria. An estimated 2 million cases of Mycoplasma pneumoniae occur annually in the US alone, accounting for nearly 20% of community-acquired pneumonia cases. When it strikes vulnerable groups, such as young children or the elderly, complications can arise, leading to longer recovery periods and an increased risk of secondary infections. Mycoplasma genitalium and Mycoplasma hominis target the urinary and reproductive organs. These infections are often spread through sexual contact and can present with symptoms similar to other sexually transmitted infections, such as pain during urination or intercourse, genital discharge, or even vaginal bleeding after sex. The most troubling aspect of these infections is that they can often remain undetected. Many individuals may carry the bacteria without realizing it, as symptoms can be mild or non-existent, unknowingly transmitting it to partners. Infections caused by Mycoplasma in the reproductive system can lead to more severe complications if left untreated, particularly for women, where they may contribute to pelvic inflammatory disease, PID, and fertility issues. Given the potential severity, practicing safe sex and seeking medical advice if you notice any unusual symptoms is crucial. The contagious nature of Mycoplasma is a major reason to take preventative measures seriously. Respiratory Mycoplasma infections, such as those caused by Mycoplasma pneumoniae, spread through small droplets in the air when an infected person coughs or sneezes. In places where people are in close contact, like schools or offices, outbreaks can occur, leading to widespread discomfort and prolonged symptoms for those affected. Respiratory Mycoplasma infections can be contagious for up to 10 days, underscoring the importance of good hygiene practices and self-isolation when symptoms are present. Meanwhile, Mycoplasma genital infections, such as Mycoplasma genitalium, spread through sexual contact. Awareness of these transmission modes can help prevent infections. For those who suspect they might have a Mycoplasma infection, seeking medical advice is critical, as treatment can minimize symptoms and reduce the risk of spreading the bacteria to others. If you're finding this information helpful, please consider subscribing to Dr. Mai's channel for more insights on protecting yourself and your loved ones from infections like these. Diagnosing a Mycoplasma infection often involves a detailed review of symptoms and, in some cases, additional testing. For respiratory infections, a chest X-ray may be used to confirm pneumonia, while sexually transmitted Mycoplasma infections may require specific tests, such as culture or polymerase chain reaction testing, to detect the bacteria accurately. One of the challenges with Mycoplasma is that common antibiotics targeting cell walls are ineffective. However, macrolide antibiotics, such as erythromycin, clarithromycin, and azithromycin, can effectively treat Mycoplasma infections. For respiratory infections, symptoms may start to ease within 2 to 3 days of starting antibiotics, though a lingering cough can persist for weeks. For those suffering from genital Mycoplasma infections, antibiotic treatment can often alleviate symptoms within a few days. However, it's crucial to complete the full course of antibiotics to ensure the bacteria is entirely eliminated and to prevent resistance. Keep in mind that antibiotics should always be taken as prescribed, and consulting a healthcare provider before starting any treatment is essential for the best outcomes. If you appreciate these health tips, make sure to hit like, leave a comment, and subscribe to Dr. Mai's channel to support us in delivering more health content. Preventing Mycoplasma infections involves several essential steps. Good hygiene practices, such as frequent hand washing and covering your mouth and nose when you cough or sneeze, can significantly reduce the spread of respiratory Mycoplasma. If you're feeling unwell, consider wearing a mask or staying home to protect others, especially in communal settings. For those concerned about Mycoplasma genital infections, practicing safe sex by using condoms and having open conversations with partners about sexual health is crucial. Although no vaccine currently exists for Mycoplasma, these preventative steps can go a long way in minimizing the risk of infection and its spread. The duration of a Mycoplasma infection largely depends on the type and severity of the infection. Respiratory infections can leave patients with a lingering cough and fatigue, sometimes lasting several weeks even after treatment. For genital infections, symptoms often resolve after treatment, but it's important to monitor for any recurring signs and consult a healthcare provider if symptoms return. If you experience persistent symptoms, like a cough that won't go away, painful urination, or abnormal discharge, it's essential to reach out to a healthcare provider. Early diagnosis and treatment can prevent complications and reduce the spread of the bacteria to others. And if you're finding this information helpful, remember to subscribe, like, and comment on Dr. Mai's channel to help us continue providing essential health insights. Mycoplasma infections are more common than many people realize, and while they are often mild, they can be troublesome and persist if not managed properly. By understanding the types, symptoms, and treatment options for Mycoplasma infections, you can protect your health and the health of those around you. If you have symptoms, don't hesitate to seek medical advice. It's always better to address these infections early and effectively. And for more detailed health insights, remember to subscribe to Dr. Mai, where we're committed to empowering you with the knowledge you need for a healthier life.